Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant. Today we're going to talk about degenerative disc disease. Degenerative disc disease is perhaps one of the most common things that we treat with patients that walk into our office. Now, a lot of people that come into our office will say, I'm 80 years old. I have degenerative disc disease. Is that a common thing? Yes, age is a little bit of a factor, but here's what I'm going to tell you right off the bat. I've seen people who are 80 years old and have a perfectly healthy spine. Everything looks good, not much degeneration, the density in the bones look really good. And then I've seen people in their 20s and 30s who have a spine that look like this, real degenerative, the bone looks weak, the disc space is terrible. It all is, the biggest factor is wear and tear. Let's take this for example. Say we have a UFC fighter, okay? They've went through a lot of trauma throughout their life, had a lot of injuries, had a lot of surgeries. Do you think they're going to have a spine that looks like this? Or do you think they're going to have a spine that looks like one of these two here? More than likely, you're going to see them more like this. Now, does that mean they're not in shape? No. It's just because of wear and tear, the trauma they've gone through. Someone who, had a 9-to-5 job every day, got up, moved around, stretched, regularly exercised, has a good diet, they're more likely to be in this category, even in their older age. So age isn't really the biggest factor of degenerative disc disease. It's the wear and tear and the trauma that we have throughout our life. So again, it is the most common thing that we see in patients. So let's just look at this one right here, and I'm going to move this off to the side for a second. Again, this is a healthy bone. We talked about the disc several weeks now. Jelly-filled donut right in there. That's that nucleus right in here, okay? That's what we want this to look like. The big space between each bone. That's what we look for. Now what happens is with wear and tear, that disc begins to degenerate like this other one over here, and what happens is it will go ahead and decrease, go bone on bone. And actually, let me do this. I'm going to compare side to side here. As we have more wear and tear, look what happens to that disc. It goes bone on bone. Here's the other thing that you start to see. This is a perfectly healthy bone here. There's no degeneration. Calcium looks good. Vitamin D looks good. That's the other factor too. We begin to deplete calcium and vitamin D, and that's what takes that whiteness out of that bone if there's depletion in there. Now look at this bone. You see these little spurs sticking up here. You're starting to see all these jagged points. Those are called spurring or osteophytes. What that is that wear and tear throughout the life. Now here's the thing, with degenerative disc disease, what's there is there. It is there to stay, it's never going away. However, it can be managed from getting worse. Now notice that I said managed and not treat. Again, it's there, so I can't eliminate degenerative disc disease. That bone will never change. What can happen is it won't get any worse with that management. So how do we treat patients with degenerative disc disease? Because it is probably one of perhaps the most common things that we treat in patients. It all depends on the severity of the case. We have mild patients, we have moderate patients, we have severe patients. A mild patient can respond very well to degenerative disc disease treatment with chiropractic care. Or someone maybe in this category where they're in so much pain, what happens is it's pushing pressure on those nerve roots. They may have pain going down their legs. They may have numbness. They may have tingling. They may require something more like decompression. And that's why I wanted to add this. This is one of the last things I'm going to talk about with decompression for a while. And we're going to move on to other topics. But yeah, sometimes patients need our spinal decompression therapy. That pulling can help open this disc space. Not to this, obviously, but it could get it to this level and even to this level if they've been managed long enough. So those are just some options that we see with patients. Now again, this was the last thing I was going to talk about this week for the decompression. We've talked about decompression, different types of conditions for quite some time now. I'm going to move on to some more common conditions that we see in chiropractic more, and then I'm going to start going into our neuropathy program a little bit more as well. So that's all I have for you guys today. If you have any questions, feel free to give me a call. I'll be happy to answer any questions. Otherwise, enjoy the rest of your day. It's a beautiful day out there. It's pretty warm. So enjoy the nice weather out there and make sure you keep your spines moving. You have a good day.